Radhe Radhe to all, and I hope everybody is doing perfectly fine. So, moving ahead in our neoplasia chapter, which I've started with. So, in my first neoplasia lecture, we discussed the basic the benign malignant. What are the different difference between the benign tumors and malignant tumors? Then we discussed in second short. These are very short lectures, so that I feel like if the small topic, if you read it in a part ways, then we are able to grasp it much better. In second one, we read about the pathways which a malignant lesion follows, like it is lymphatic, hematogenous, or direct seeding. So today, what we'll be discussing a very common thing, that is a basic difference between carcinoma and sarcoma. Few points which we should remember when we are assessing any case of carcinoma or sarcoma. So let's start with, it's very small topic. So carcinoma. So carcinoma that we had read last time, that malignant lesion जो follow करते हैं, carcinoma में हमने पढ़ा था कि that is like basically how it arises. It is from your epithelial tissue. Okay, we'll see in the next slide about sarcoma. Then second point is it commonly arises from your gastrointestinal tract, breast, or genitourinary tract. Then it is much common when you assess the incidence of carcinoma versus sarcoma. What you find is carcinoma is much common as compared to sarcoma. And this we had read it. It follows lymphatic spread. And metastasis is usually to your lymph nodes, lung, liver, bone, and brain. Then coming to your growth rate. So when you consider, so carcinoma, obviously it has a faster growth rate. So why I have written less? It is as in comparison to your sarcoma. So when you compare the growth rate of carcinoma as compared to sarcoma, it is relatively less. Then when you see the gross feature of a carcinoma, it is proliferative, ulcerative, fungating, infiltrative growth type. Okay? And when you see is there is hemorrhage and necrosis, because these are the features, the variegated appearance hoti hai ki you have your solid area, you have your cystic areas, you have necrotic area, you have hemorrhagic areas, okay, yellow fatty area. So variegated is a different kind of a picture you are getting on the cut section of the tumor. Then what are the different examples? So like breast carcinoma, oral carcinoma, so all those cervical carcinoma, so all those are example of your carcinoma. And good thing is that carcinoma are usually radio sensitive. So they respond to radiotherapy. So these are the basic point which you should remember for your carcinoma. एपिथेलियल टिश्यू से ओरिजिन होता है यूजुअली ये जीआईटी जेनाइटोइनरी ट्रैक्ट एंड ब्रेस्ट से राइज करता है ये मच कॉमनर एज कंपेयर टू योर सार्कोमा इट हैज अ लिम्फेटिक स्प्रेड ठीक है एंड इट metastasizes usually to your lymph node, lungs, bone, liver, brain, and it has relatively less growth rate as compared to your sarcoma. Then grossly we see it as a proliferative, ulcerative or infiltrative mass with hemorrhage and necrosis in it, but it is usually less as compared to your sarcoma. And examples are your breast carcinoma, cervical carcinoma, oral carcinoma, that is squamous cell carcinoma, and these carcinomas are radiosensitive, so they respond to your radiotherapy. So then moving ahead to your sarcoma. तो sarcoma में आप क्या देखते हो? So this arises from your mesenchymal tissue. जो वहाँ epithelial था ये mesenchymal है. And ये usually arise करता है from your bones and muscle. So now that they were the route which was followed for metastasis was lymphatic spread. Lymphatic spread. So sarcoma, what it spreads through hematogenous spread. Metastasis is usually to your bone, liver, and lungs. Growth rate, there I had written is relatively less as compared to your sarcoma. Here it is very rapid. Grossly, these are also proliferative mass. And what you will see is that it is so much a faster growth rate that it will invade or infiltrate the surrounding structures. And they have extensive hemorrhage and necrosis. This what I said, hemorrhage necrosis कार्सिनोमा की ग्रोथ उसमें भी होती है ट्यूमर के कट सेक्शन में बट जो यहाँ आपको कट सेक्शन में जो वेरिएशंस मिलती है जैसे व्हेन यू सी सपोज दिस इज अ किडनी सो व्हेन यू आर गिविंग अ कट सेक्शन वी आर ओपनिंग इट लाइक अ बुक so book में जब when you open like a book what you are seeing the cut surface so here you have your hemorrhage यहाँ necrosis यहाँ cyst है यहाँ solid areas है so those areas are less in comparison to your sarcoma carcinoma में कम होता है sarcoma में बहुत ज्यादा होता है extensive होती है and sarcomas are usually radio resistant so they are less मतलब उसको हम less you can say कि radiotherapy से वो respond ही नहीं करेगा usually example इसके देखो rhabdomyosarcoma, Ewing sarcoma, osteosarcoma so all these are sarcomas So this today what we have discussed is basic difference between your carcinoma and sarcoma, which you have some points which you should keep in mind. जो different basic difference बताते हैं. Fine. The next lecture what I'll be uploading is your जो 8 molecular signatures होते हैं, the molecular phenomena होते हैं which leads to neoplasia. So that will be a bit longer lecture as compared to these small lectures. So thank you so much for your patient hearing. So kindly like, subscribe and share my channel Patho with MK. Thank you so much.